So welcome to this new CSF service highlighting the latest papers in cytokine signaling and IL-6 biology. All the content discussed is available in more detailed slide format at cytokinesignaling.com, our free resource website. This month we're highlighting two papers. The first is brought to you by our friends at University College Dublin and examines the effects of tofacitinib in tissues derived from people with psoriatic arthritis. Patients who are pretty typical of a psoriatic arthritis population were asked for donations of synovial fluid cells, tissue, and cultured in vitro with tofacitinib. And the first key observation was that tofacitinib inhibited phosphostat-3 and phosphostat-1 expression and actually induced negative inhibitors of STATs, SOX3, PI3S3, compared to vehicle control. This was functionally important because tofacitinib also inhibited, for example, fibroblast invasion and network formation. It also reduced secretion of IL-6, IL-8 and MCP-1, but had no effect on release of, for example, IP-10 or IL-10. And really importantly for a disease of tissue modeling, there was inhibition of spontaneous release of MMP-3 from the PSA synovial tissues, but no effect on TIMP-3, giving a very favorable effect on the MMP-3-TIMP-3 ratio. For a summary, therefore, a very interesting ex vivo study suggesting inhibition of pro-inflammatory and invasive pathways, but that, of course, now needs to be further explored in the clinic in the context of clinical trials. The second paper we want to highlight comes from one of our steering committee members, Professor Cem Gabay, and a variety of other highly esteemed colleagues across the European Registries network. And this was a study which aimed to look at the effectiveness of tocilizumab with and without synthetic DMARDs in people with rheumatoid arthritis. The primary objective was to look at impact on the effectiveness of this drug in people in real life, either as monotherapy or as a combination therapy. And the primary outcomes examined concerned changes in CDAI and also drug retention. The key results are as follows. CDAI at baseline at tocilizumab initiation was actually influenced by country of registry, year of tocilizumab treatment initiation, and also the number of prior biologics and gender. CDAI decreased rapidly after tocilizumab treatment, regardless of whether tocilizumab was used as monotherapy or in combination with synthetic DMARDs. The frequency of disease remission, as judged by CDAI less than 2.8, was about 20% overall. Interestingly, tocilizumab retention was shorter under monotherapy than in combination. So a very interesting real-world analysis of an effective drug telling us more about how it can be used in people with rheumatoid. So, in summary, don't forget that all of these materials are available to you online at www.cytokinesignaling.com. Thank you so much for your continued support of the website. And we'll send you an update shortly reviewing some key abstracts that we're going to see this year at ACR in San Francisco. See you there.